IBS, and chronic gas trouble. When your stomach has a mind of its own.
Hello everyone, welcome back to our wellness podcast today. Joining us is Dr. Sandeep, Chief Ayurvedic Practitioner, Krishnendu Ayurveda Hospital and Nirava Holistic Center. Sandeep, so the kind of patients who are maximally frustrated these days are people who are suffering from IBS. So all their blood report, everything looks absolutely normal, but most of the time they either spend it in the washroom or they'll have clear signs of bloating. So how do we manage this?
Yes, that's exactly right. IBS isn't a structural disease, it's a functional imbalance. So the gut looks fine on the scan, but it behaves like it's on the edge. Every small stress or skipped meal or even a wrong food triggers the chaos, right? So Ayurveda describes this as a vata kind of an imbalance in the abdomen. So too much movement or too little grounding, so air gets trapped and digestion becomes more unpredictable, and the person starts living in the fear of their own stomach.
That sounds very exhausting, both physically and mentally.
So when such a patient comes in, our first goal isn't to medicate, it's to stabilize the rhythm. So we begin with warm, light food served on time, and abdominal oil therapies like Nabi Basti is done. That helps to release the trapped air. Also, medicated steam is done to relax the intestines. And once the body softens, we slowly rebuild digestion using detox procedures like enema or basti and even virechana.
So it's like retraining the gut basically to trust your body again?
Yes, exactly. The intestines are like a sensitive child. They respond to tone, pace, and even mood. So when you feed them with stress, they cramp up, and when you feed them with calm, they kind of flow. So in our inpatient programs, we try to create that calm for a week or two. So structured days, gentle therapies, and food on time, like early dinners, and mindfulness after meals. The patient often tells us that my stomach feels quiet for the first time in years.
So most of the people that I meet say that they feel very bloated even if they haven't eaten. So what exactly is happening there?
Because gas isn't always about food, it's about trapped emotion and irregular digestion. So when digestion weakens, when small amounts of food ferment inside. So add to the sitting for long hours, dehydration, or eating cold food, and the gas has nowhere to go. So our therapies are mainly done to restore this movement. So once air starts moving, pain and heaviness starts to reduce naturally.
That's very fascinating. So the people who oscillate between, diarrhea and constipation in terms of IBS, how do we handle that?
So that's the body's way of showing confusion. One day it's holding on and the next day it's letting go. So we correct that by regulating the meal times, sleep, and even by internal medications. So even emotion is also very important. So anti-stress based therapies have to be done. This regularity rebuilds stability. So by the end of the treatments, the bowels normally settle down, the appetite becomes more natural, and the fear of flare-ups also slowly reduces.
That would be a huge relief to a lot of the patients who has been suffering with IBS and who believe that nothing really works for them. So what would you like to share to our viewers who has been suffering with IBS for a prolonged period of time?
Don't keep fighting your stomach. It's not rebelling, it's protecting you. IBS is your body's way of saying, slow down, breathe, and trust me again. With the right food, rhythm, and rest, your gut will remember how to work for you and not against you.
Thank you all for listening to our wellness podcast today. Hoping to see you all for our next session.
Book your consultation today at 954-448-8333 and start your healing journey. Follow on Instagram, Facebook, YouTube,